0 dB.
Well, I'm still awake and I'm feeling like I should go to sleep, but I don't think I can because I'm a bit too high strung at the moment. Just very highly driven, or whatever you bloody call it. Yeah. Very much like I could be getting out of bed and making a cup of Milo or doing something, because I'm lying here because I am really aching with my legs from walking so much last night I could hardly walk. But I'm like really energetic, and yet I'm very stuffed all at the same time. I am totally buggered. My mother's ex-boyfriend actually used to say, "Do you know what the word buggered means?" And I'd say, "Yes, but that isn't what I'm talking about." I'd say, "You know what, I'm so buggered tonight." And he'd say, "Do you know what that buggered means?" And I'm just like, "Not that, mate. Just normal buggered. Just exhausted buggered, not the other one." Well, I feel pretty good after the course of antibiotics finished today, so now it's a matter of seeing how I go with treatments. I don't think my GP is going to remove the bar out of my arm. I think the specialist is going to do it. Oh, God. I think some GPs specialise in gynecology, others don't. And some doctors do pap smears and some will not. They refer you to another doctor for a pap smear. And since I guess this is already not safe for kids, I might as well say it anyway. They like to do pap smear on people even if they reckon they've never had sex, just to make sure that you're not lying, because, well, I'm not lying, but that they have to make sure that everyone isn't lying, because some people lie and most people don't. And they still, for some reason, I don't know what it means, but they have to check for STDs regardless, for whatever stupid reason. And if it's not an STD, it could be other infections building up in your own body, so they have to make sure that it's not caused by another, whatever's wrong with your sex organs isn't caused by another condition in your body, like cancer or viruses that ruin your body and things like that. Oh, God. But yeah, anyway, this is how the medical people work with your body. I don't know. I don't know what.
Now, Stephanie Mitchell, notification.
Oh, hang on, it said notification. Don't worry about it.
Stop. Pause.
Don't worry about it. I've got
Pause. Stop. Pause.
I've got previews turned off, so now it won't give me a preview of the notification.
Stop. Pause. Button. Stop. Pause. -11.
I just had to read a message on WhatsApp, and now I'm back.
Pause. -30.
Personally, due to being non-religious, I don't hold to some religious views that other people hold to, so they might have conflict with me, and that's fine. We can't all agree on the same on the same subject matter. But at the same time, I'm going to say things that tend to strive with some people. So if it causes strife, either skip what I'm saying or respect that that's how I believe things to be, please. Because, yeah, I don't make decisions in my life to affect everyone else. It's about affecting my own life. It's about controlling my own life. And if other people feel affected, they might need to think. I don't mean people necessarily who are listening to this recording, but just like anybody will need to be thinking, hang on, is this person living for me or are they living for themselves? So long as I'm not trying to affect other people, then yeah. Well, actually, what does affect other people is when, I look uncomfortable or keep complaining. People don't want to keep on listening to complaints. So it's like, yeah, be ready for a controversial recording, by the way, guys. It's basically like you don't want to complain because people don't want to hear complaints. So either you've got the choice of getting some nice professional help, if you can even find it, because there isn't much professional help out there, whether you like to think so or not, there really isn't. You have to really look for it. Or you commit suicide. It's one way or the other. And that's just so that you don't burden everyone else or the professional help system out there, which is already burdened with problems and so many issues that they are trying to help people with, that some people may not get help or whatever, so anyway, I'll see how I go with this birth control in my arm. I don't think it's very good birth control, but that's my opinion. It's not very good. It's starting to fail, but we'll have to see what goes on from there. I'm going to be letting the specialist know if they could scrape my uterus, do it. If they find any complications, I don't want them to wake me up and ask me to decide to take my uterus out. If they have to do that, then I will just give up. I just won't go back. They're going to help me properly first time, first go. If they can scrape it, that's great. If they don't, yeah, they're going to have to do something about that, because it's normal to have surgery. It's a part of life, You can avoid surgery as much as you want to avoid surgery and your life might be fine. But in some cases, you can't avoid surgery. It just isn't going to work. So yeah, I plan to get my uterus lining taken away. I don't really want it. I want it to be taken out of it. I think the lining might actually grow back eventually. It might just grow back. I think that the uterus lining will grow back. And even if if there's a way to stop it growing back, that'd be good. But say it does, then I'll just, get it sorted, because, yeah, I don't think there's any excuses for any living creature not to have an operation sometimes. So yeah. I think, when people make up a drama about operations and that, I just think people are trying to not accept reality for what it is, There's no point whinging about reality. I mean, you can whinge at the moment in time that you're not well or you don't want to have surgery, you can have a whinge, but at the same time, sitting back trying to avoid reality isn't going to fix it either. It's a bit like I need to get my teeth fixed in the next few months. So rather than avoiding reality and waiting until I'm in the hospital really crook with a mouth infection, I'm going to take something to make me sleepy, and I'm going to get my teeth fixed. It's going to hurt, but it's not something you can hide from and say, well, what's the alternative to getting my teeth fixed with a medical procedure? Well, there's no alternative apart from pulling out my teeth, which isn't going to happen. So I have no choice but to get them fixed. So it has to be done. And my uterus is no exception. As hard as it sounds to accept, every single body part of mine, well, not literally every body part, but you know what I mean, every single body part has the potential to need fixing, and you need surgery to fix most things. So there's no point in doing alternative treatments when the truth is surgery is always the best way to fix something. Obviously, you can have a sling for a broken arm, you can have rest for a broken rib, but, you know, anything worse than that and you need to get something done about it. You know, you can only hide from reality for so long. And some people are comfortable with their periods, some people are not comfortable with their periods. You can deal with the discomfort for so long. Look, until I had this bar put in my arm, and I'm getting back to that stage anyway, so I guess forget what I said about the bar. At least until now, I had usually had to take painkillers every 4 weeks for 3 or 4 days. And then I discovered in February that I actually had to take painkillers in the middle of the month, thinking that that was when a period was coming on. And then it would come on either 2 days later, but sometimes 10 days later. So in fact, I hadn't realised for some time now, it could have been up to 2 years. I thought, no, I don't think I'll feel pain in the middle of the month between periods. I think it just happens around my period. But then in February, the doctor was asking 100 questions, and I'm like, oh, you're serious? That means that it is pain between periods. So here I am thinking, yeah, I'm in pain right now because my period's going to come tomorrow, and it almost never came when I predicted it to come. I had unpredictable periods. And then I get this bar in my arm, and it hasn't fixed anything. Oh, well, it worked for 6 months. With the injection, that didn't fix my periods very much. It gave me 3 unpredictable periods. So it was still the same. Only difference is, then I eventually skipped, and then I got the bar put in, and I kept on skipping periods and had a little bit of unpredictable blood spotting. See, everything is not regular. I do not have a regular menstrual cycle. I don't have a regular rhythm. It's very unpredictable. And the bar, even though it makes me skip periods, it doesn't make anything regular whatsoever. I'm actually concerned about going onto the pill, because if they take the bar out and I go on the pill, I'll be fine until I have a period, and then I'll be taking Nurofen and Panadol for 4 days, 3-4 days, just to get rid of the pain, and I'll be back at square one while I'm on the pill. Maybe then we could bring it back to twice a year. Yeah, and I'll be blood staining my clothes and everything. And to me, that's not a normal part of life. I mean, it's normal in terms of the body working, but it's not a normal part of my own lifestyle to deal with that. It is a pain, it's a hassle, and you can deal with anything that's a normal part of life, but that doesn't mean you have to accept it. It doesn't mean you have to have it that way as status quo forever. It's normal to have tonsillitis. Do we keep our tonsils when they're infected? Nah. It's normal to have an infected appendix too, but that doesn't mean you keep your normal, natural appendix. And it's not useful. And yet sometimes it has to be removed. And yet we don't always remove our appendix, even though it's useless. You know, it has some use, but it's not much. Like wisdom teeth aren't really useful in the body. They're just your back teeth. And yet the dentist decides when they can and can't be removed. It's like doctors seem to think they can decide what and what can't be removed. What can and can't be removed at any whim, I guess. I heard some remarks, and I don't mean against anyone personally, but when some people tell me that, you know, I can get some treatments done without going the whole hog with invasive procedures, you know what? I don't think like that. I don't really think, oh, I'll do this instead of that. I don't think that's reality. I think, yeah, okay, I see what the person means. I do see what they mean. You know, but at the same time, you've got to live life. And sometimes bad things happen in your life. And you know, going the whole hog, as much as it feels uncomfortable, well, sometimes it's got to happen. Anyway, we'll see what goes on with my medical stuff in the next few months. You never know. Yeah, you never know, really, when it comes down to all this sort of stuff. The doctors might come up with some new technique that will just be, you know, give you a needle once a year and then you don't get any period. Something like that. Personally, I think that going medication free would be the ideal thing for me. I'd like to go medication free where I have no hormone therapy or medication therapy, if I can go with that. Because I don't really like medication all the time, but this is what happens. But yeah, I think that I'd like to have a treatment done where I can go medication free after the procedure's over. So I can go medication free and not have to worry about any of that other stuff. I must admit that if anyone's going to get their wisdom teeth out, don't do it unless they think they have to do it, that's for sure, because it does hurt. And I don't care what part of your body people are dealing with, everything hurts. Your hands can hurt, your teeth can hurt, your body can hurt. And pain can feel different, I suppose, but there's no such thing as agonising, agony free. You're in agony no matter what's wrong with you. Saying, well, certain types of surgery hurts worse, I reckon it all hurts the same. It's all the same pain. It feels different, but it's like all the same type of pain. You can't get away from pain. There is no such thing as pain relief. Everyone will say that there is, but there isn't. You can't relieve pain by that much. You can't really. I think there's no way you can actually relieve pain. You can have Panadol and make it tolerable, make the pain relief a bit of an experience, but at the same time, there is no such thing as pain relief. You feel pain whether you like it or not. I've been walking around with a sore toe now for weeks. Weeks and weeks and weeks. Do you think I'm getting that fixed? No, because it's only a sore toe. It's not a sore head. It's not a sore stomach. It is just a sore toe. I can actually deal with a sore toe. I can't deal with a sore stomach, but I can deal with a sore toe. I don't know why that is. I don't get it, but it's just how I am. I can handle a sore foot. I guess when it starts playing up really bad, beyond hurting, it starts really yuck. Okay, then I'll do something about it. But I actually have an easier time dealing with sore feet than I do anything else. I don't know why. Maybe because it's my feet and not something else. Who knows? But oh well. I guess if anyone says to me, oh well, your foot doesn't look good, you need to fix it, I'll be like, okay. But no offence, but I can't understand what everyone's drama is about surgery. I just can't understand the drama. Millions of people go through surgery every day. Some people get really sick and some people don't. It's just how it is. I don't see the drama in having surgery. I just can't see the problem. The problem I see is people getting traumatised more than they need to be. It's going to hurt, but you don't have to turn it into a big deal and keep on saying that it hurts, People don't need to hear you saying 6 times that something's painful. You only need to hear it once. And, you shouldn't have to turn everything into a big drama. That's how I see it. I think it's a drama when you might die and you need help and you need your life back. Then it's a drama, and then you cry and whinge and complain. And you might say 10 times that you have a sore stomach and you don't know if you will recover or not. Well, that's because you're terrified, and that's fine. That's an example, like what happened the other day. It was a drama because it needed to be. When it comes to surgery, you know what's going to happen. Surgery hurts. The predictable outcome is that you'll be getting cut open. Don't whinge about it. Just accept it. It's what happens. It's not an accident. You're doing it on purpose for a reason. And if you're going to turn it into a drama, then stay sick then. Just don't get anything done and just stay crook. And then you eventually go to the emergency room and they force you into surgery anyway. So, don't turn it into a drama. And it's funny because elective surgeries start out as elective, but not in all cases, because all cases are different, but there are some situations where they like you to have elective surgery before it becomes really serious, because then it's not elective anymore, it's an emergency. So it's involuntary, so it's not elective. Whereas if you start out as elective surgery, then it's easier for the doctor to help you when it's not an emergency. If that makes any sense. Some things will become serious, requiring emergency surgery, so just go for the elective operation to fix what's wrong with you so it doesn't become serious, and then you don't need an emergency operation. That's the way things are. Like if I don't get my teeth fixed in the next few months electively, which I don't like, but I have to do it, if I don't choose the elective way, I'll eventually end up in some kind of emergency care situation and be like really crook. It's something simple now that they can fix, but if you leave it, it gets really serious and it's even worse for you to recover from. So why not go through some trouble when you're healthy and recover very fast, rather than wait until you're really out of it and you'll recover so slowly, you know. You might as well get everything sorted before you get very sick. But yeah, my toe, it's pretty sore, but I'm going to see if it's no better by next week. I guess I'll be going off to the doctor's to get a podiatrist referral or something done about my toe. Definitely. So, yeah. Anyway.
Pause. Stop.
I guess that's
Button.
all I've got to say for tonight.